And welcome back to Hoax-Videos.com. I'm Janet Cimorelli, licensed nutrition counselor, and I'm here to introduce you to our format and what we're going to be talking about on Hoax-Videos.com. And each week we're going to introduce a subject, talk a little bit about the background of the subject, maybe how medicine approaches that subject, and we talked about the introduction, the causes. Now we're going to talk about the testing. Again, when you are dealing with mainstream medicine and kind of leaving at the side nutritional medicine, functional medicine, herbal medicine, a variety of additional healthcare approaches, your situation might not necessarily become very well known so that you understand the underlying causes. So the testing, one of the favorite tests that I would do nutritional evaluation. They would tell you how much of different items you might need in order to achieve optimal function. And I'm sure Dr. Slavin has plenty of tests that he uses that might not necessarily be available to patients of mainstream medical practitioners.
Now, it may come as a surprise to our viewers, who are also potential patients somewhere, that doctors are trained in medical school that 90% of the diagnosis is determined by the history you take, in other words, talking to the patient, and 10% by testing. But they've reversed that. Now it's 90% is testing, and they don't spend much time at all talking to the patient. So that's why talking to the patient is very important. Important for the patient to come prepared when they see the physician to really describe exactly what they're feeling, instead of jumping to a diagnosis themselves. A lot of times the patients say, I have a thyroid problem. And it may not be a thyroid problem, but you just think it is. So you have to go back to just how you're feeling so the doctor can try to determine what's going on.
Okay, do you think that it's important as part of this testing that in addition to talking to the patient, that certainly listening, and with regard to what you just had to say about thyroid, sometimes a family, grandmother has thyroid problems, the mother has thyroid problems, the sister has thyroid problems, and they start to think about, the patient comes to see the doctor, is there any validity for them to say, okay, I have a thyroid problem, doc?
Well, thyroid is a very complicated topic because doctors are trained to follow the lab test results. So the next question to be asked is, can you have normal thyroid tests and still have a thyroid problem? Mainstream medicine says no. If your thyroid blood tests are normal, you don't have a thyroid problem. But then you have to ask, well, how come my patient has so many symptoms that would be found in a column of a thyroid problem? They may feel fatigued, they may have high cholesterol, they may have depression, and you're thinking, oh, those aren't thyroid problems, those are drug deficiencies.
So here's my way of testing, particularly thyroid, since we brought that up. Okay, I ask my clients, can I feel your hands? Oh, are your hands and feet cold a lot? So I might not necessarily put 100% confidence in the thyroid blood test, but I put a great deal of confidence in the sensation that I get when I feel a client's hands. I take a look at the client's face because there are facial characteristics for thyroid issues. So there are so many different ways of testing that go far beyond that mainstream medical testing, and that's one of the things that we'll be bringing to you here on healthcarehoaxvideos.com. And keep in mind, we'd like you to subscribe, and keep in mind, we'd like you to share, and that doing all of this will help to keep us bringing more and more information to you. Dr. Slavin, what else do you have to say about testing?
Well, I want to say an important test that can be self-administered by anybody with regard to the thyroid and determining whether thyroid is dysfunctional or not is the basal temperature. Something you can check yourself. When your thyroid is functioning normal, your body temperature is going to be higher than it would be when your thyroid is under functioning.
And you know what? Sometimes the doctors tell my clients, wow, we used to think everybody's body temperature was 98.6, but now we know better. And they're happy if their patient's body temperature is 97, 97.5. What do you have to say?
I have to say they're wrong. And they're wrong because they're not listening to the patient. And the body operates ideally at around 98.6. The biochemical reactions in the body occur ideally at that temperature. When your body temperature drops, things are going to become less effective. So the basal body temperature is an important sign, not to be taken in a vacuum. You talk to the patient, see if they have other symptoms that go along with it, and then you do a thyroid blood test, and it should be consistent. Now, the problem with most testing, including the thyroid test, is that the range of normal is so broad that they're encompassing patients who have a thyroid problem within the normal range. And it shouldn't be, because they didn't talk to those patients. They just grabbed a bunch of people off the street. This is how they do testing. They do a questionnaire. How do you feel? You feel fine? Okay, we assume you're normal. And we'll see what the range for that test is. If it's a thyroid test, they see what the range is. If it's blood sugar, they'll see what the range is. Instead of trying to look for people who are in good health, ideal health, and see what the range is for those. For example, if you were to take a fasting blood sugar, they give you a range somewhere between 60 and 100. That's pretty broad. And it would be better, the lower you are in that range, the better, but you could be 99 and it'll say you're in range. And that's part of the problem. The ranges are too broad for certain things. Now, if you were testing electrolytes like potassium, the range is very narrow, which is probably better. But that's where talking to the patient, finding out what the patient is experiencing, comes in, because if you just categorize people based on where they come out on a blood test, you're going to be missing a lot of people with a problem that could be helped by addressing, in this case, an underactive thyroid, which, by the way, is a lot more prevalent than an overactive thyroid.
And so I hope you've gotten a little bit of a glimpse into the idea of what we are bringing to you here on Healthcare Hoax videos. And the Healthcare Hoax is to overcome the very minimal testing that you might be exposed to, and to understand that, yes, indeed, you are going to have a variety of different test procedures or observations that are really going to give you a glimpse into the underlying cause of your health issue. And we kind of focused on the testing of thyroid and blood sugar today, but when we introduce a variety of different subjects for you, different situations that you might be dealing with, we will give you the kind of broad information about testing to get you to the real answers. So don't forget, when you go to healthcarehoaxvideos.com, click on the subscriber button. Don't forget to share and to like our videos. And keep in mind, the healthcarehoaxvideos.com is a quick link to get you to YouTube so that you can see our videos. Thanks for tuning in.